Hello, my name is Dr. Greg Smith, and today first I'm going to tell you about 5 powerful foods that help flush your kidneys naturally. Simple choices that can lower kidney stone risk, reduce inflammation, and boost your daily energy. Your kidneys quietly filter about 50 gallons of blood every day, yet dehydration, excess salt, and processed foods quietly overload them. The problem shows up as fatigue, bloating, or sometimes a painful stone when it's too late. The solution is surprisingly tasty. In the next few minutes, first I'll reveal the top 5 kidney-supporting foods, why they work, and exactly how to use them in quick meals and drinks. You'll get 1 easy daily drink to increase urine flow, 2 snack swaps to cut sodium and boost hydration, and a simple salad tweak that helps prevent mineral buildup. Follow along for a 7-day integration plan at the end. Try the first recipe tonight, and let me know how you feel in the comments. 1. Role of kidneys in aging organisms. Hello, my name is Dr. Greg Smith, and today first I'm going to tell you about how kidney function changes as organisms age and why that matters for overall health. Kidneys are the body's primary filters, removing metabolic waste and regulating fluids, electrolytes, acid-base balance, and blood pressure, functions that become more fragile with time. As people grow older, the capacity to concentrate urine diminishes. This raises the risk of dehydration, electrolyte swings, and accumulation of waste products that the body can no longer clear as efficiently. Declining renal reserve creates a real problem. Older adults are more vulnerable to acute insults such as dehydration, infection, or medication side effects that healthy kidneys could withstand. Prevention and mitigation are the solutions that matter most. Simple, practical measures: blood pressure control, careful medication review, hydration tailored to heart and kidney status, and routine lab monitoring can preserve function and reduce complications. Early action pays off. At the tissue level, aging kidneys typically show a gradual loss of nephrons and changes in the filtration barrier, with scarring and reduced renal blood flow. Functional consequences include a lower glomerular filtration capacity, impaired sodium handling, reduced ability to concentrate or dilute urine, and altered drug clearance. These changes explain common clinical signs: increased sensitivity to nephrotoxic drugs like nonsteroidal anti-inflammatory medications, for example, ibuprofen, a greater tendency toward hyperkalemia when on certain blood pressure medicines, and a higher incidence of anemia when erythropoietin production falls. Integrating this knowledge into everyday care means targeted screening and individualized management. Regular checks of serum creatinine and electrolyte levels, medication reconciliation to avoid unnecessary nephrotoxins, tailored dietary advice on sodium and protein intake, and close control of diabetes and hypertension all help maintain kidney health. Talk with your healthcare provider about how often to monitor kidney markers and whether any current medications should be adjusted. Act now by scheduling a kidney health check if you are middle-aged or older. Review any over-the-counter drugs with your clinician and adopt habits that support stable blood pressure and hydration. Small, consistent steps protect kidney function and improve quality of life as organisms age. 2. Signs of kidney toxin buildup. Hello, my name is Dr. Greg Smith, and today first I'm going to tell you about how to recognize when your kidneys are struggling to clear toxins and what early warning signs to watch for. Toxin buildup in the kidneys often starts quietly. Many people notice only subtle changes at first. Little shifts in daily energy, urine habits, or skin sensations can be the first clues that filtration is impaired. Persistent fatigue and poor concentration are common and often overlooked. Feeling unusually tired despite normal sleep, losing appetite, or experiencing a metallic taste in the mouth can indicate that waste products are accumulating in the bloodstream. Changes in urination are another clear cluster of signals: going more often at night, producing much less urine than usual, seeing dark, tea-colored or unusually frothy urine, or spotting blood. Each of these deserves attention, and a simple urinalysis can reveal protein or blood that points to kidney stress. Swelling in the hands, feet, or around the eyes is a practical, visible sign. When the kidneys can't remove excess fluid and salt effectively, fluid pools in the tissues. High or difficult to control blood pressure frequently accompanies impaired kidney clearance. Short, Sharp episodes of breathlessness during ordinary activities or swelling together with breathlessness can signal fluid overload and should prompt immediate medical evaluation. Persistent nausea, vomiting, and unexplained weight loss are additional systemic signs that toxins may be affecting digestion and appetite. Muscle cramps, especially at night, and an ongoing itchy or dry skin condition can reflect electrolyte imbalances linked to reduced kidney function. Blood and urine tests provide objective confirmation. A primary care provider will check for elevated waste markers in the blood and for protein or blood in the urine, and may order imaging if structural issues are suspected. While lifestyle steps, consistent hydration, moderating salt and processed foods, and avoiding regular use of over-the-counter NSAIDs, can reduce kidney stress, the solution begins with recognition and timely testing. If symptoms are mild, follow up with your clinician for targeted labs. If you experience very little urine, severe swelling, chest pain, sudden shortness of breath, or confusion, seek emergency care. Take action by tracking any persistent changes and sharing them with your healthcare provider. Request a basic kidney panel and urine dipstick if you notice the signs described here. Early detection makes a big difference in reversing or slowing toxin buildup, and integrating simple habits with medical oversight is the most practical path forward. If this information was helpful, schedule a checkup, note any symptoms, and discuss next steps with your doctor. 3. Berries and their antioxidant effect on kidneys. Hello, my name is Dr. Greg Smith, and today first I'm going to tell you about how berries can help protect your kidneys through their powerful antioxidant effects. Oxidative stress and chronic inflammation are two of the main pathways that damage kidney tissue over time. When free radicals accumulate, they injure cells in the filtration units of the kidneys and can accelerate loss of function. This is a real problem in people with high blood pressure, diabetes, or long-term exposure to environmental toxins. The good news is that dietary antioxidants can blunt that process, and berries are among the most effective whole food sources. Berries such as blueberries, strawberries, raspberries, blackberries, and even cranberries contain high levels of anthocyanins, flavonoids, and vitamin C. These compounds neutralize free radicals directly and also modulate cell signaling pathways that control inflammation. In practical terms, that means regular berry intake has been associated with lower markers of oxidative stress and reduced systemic inflammation in both animal studies and human trials. Some clinical research has shown improvements in endothelial function and modest reductions in blood pressure after adding blueberries to the diet, which indirectly eases the workload on the kidneys. Animal experiments and small human studies have also reported decreases in biomarkers linked to kidney injury when antioxidant-rich foods are consumed. Mechanistically, anthocyanins can improve vascular tone and reduce oxidative damage within the microvasculature that supplies the kidneys. Flavonoids influence cellular antioxidant enzymes and can lower the production of pro-inflammatory cytokines. Vitamin C contributes additional free radical scavenging and supports collagen and tissue repair processes. Whole berries also bring fiber and other phytonutrients that support metabolic health, better blood sugar control, and lower blood pressure reduce, one of the main drivers of kidney damage. For example, adding a cup of mixed berries to breakfast or a smoothie provides an array of these compounds in a form that is easy to absorb and use. Practical application is straightforward. Eat whole or frozen unsweetened berries rather than sweetened juices or syrups. Toss them into oatmeal, blend with plain yogurt, or add to a salad for both flavor and function. Keep in mind that people with advanced kidney disease should check with their nephrologist or renal dietitian about portion sizes, because dietary potassium and oxalate considerations vary by individual. Also be cautious with added sugars. Preserved or sweetened berry products can negate benefits. If you want to test their effects, try incorporating a daily serving of fresh or frozen berries into your meals for several weeks and discuss any changes in blood pressure, blood sugar, or kidney-related lab results with your clinician. If you found this useful, consult your healthcare provider about adding berries into a kidney-supporting eating plan and consider trying one new berry-based recipe this week. 4. Leafy greens, benefits, and oxalate cautions. Hello, my name is Dr. Greg Smith, and today first I'm going to tell you about leafy greens and how they can help, or sometimes harm, your kidneys. Leafy greens are powerhouses of potassium, magnesium, folate, vitamin K, and antioxidants, all nutrients that support blood pressure regulation, vascular health, and reduced inflammation, factors that matter for kidney preservation. At the same time, some greens contain high levels of oxalate, a compound that can raise urinary oxalate and increase the risk of calcium oxalate kidney stones in susceptible people. That creates a clear problem. You want the benefits without increasing stone risk. The practical solution is to choose your greens wisely and prepare them in ways that lower oxalate absorption while keeping nutrients intact. Favor lower oxalate options most of the time, and use high oxalate greens occasionally and with care. Cooking techniques such as boiling or blanching and then discarding the cooking water will leach out much of the soluble oxalate, reducing the amount that reaches your gut. Pairing oxalate-containing meals with a dietary source of calcium, like yogurt, milk, or a calcium-fortified alternative, binds oxalate in the gut and limits absorption, so combining spinach with a cheese-topped dish or having a glass of milk with a spinach-rich meal is a practical step. For real-world choices, remember that spinach, Swiss chard, and beet greens are among the higher oxalate leafy vegetables and are more likely to contribute to urinary oxalate when eaten frequently and in large amounts. On the other hand, kale, arugula, bok choy, romaine lettuce, and watercress are relatively low in oxalate and make safer everyday staples. Smoothies are a concentrated example to watch. Blending large amounts of raw spinach or chard concentrates oxalate and can be risky for people prone to calcium oxalate stones. Switching to kale or romaine, or adding a calcium-containing base such as plain yogurt, reduces that risk. Also, avoid relying on high-dose vitamin C supplements if you have a history of oxalate stones, because large supplemental vitamin C can increase urinary oxalate. Integration into meals is simple. Rotate in low-oxalate greens for salads and sandwiches. When you do use spinach or chard, cook and drain them and serve alongside a calcium-rich food. Keep portion sizes moderate and avoid multiple oxalate-heavy items in the same meal. If you have reduced kidney function, bear in mind that the potassium content of many greens can matter. Individualized guidance from your clinician or renal dietitian will tell you whether you need to limit or monitor potassium intake. If kidney stones or chronic kidney disease are concerns for you, speak with your nephrologist or a registered dietitian for personalized advice and consider tests like a 24-hour urine analysis to identify specific risks. Try swapping one raw spinach smoothie each week for a kale-based version, and notice how small changes can keep the kidney-supporting benefits of leafy greens while lowering oxalate-related risk. Consult your healthcare team and take action that fits your medical picture. 5. Hydrating foods that support filtration. Hello, my name is Dr. Greg Smith, and today first I'm going to tell you about how certain hydrating foods can ease the workload on your kidneys and support better filtration. When kidneys don't get enough fluid, blood becomes more concentrated and waste products are harder to clear, which raises the risk of urinary crystals and can worsen feelings of fatigue. Many people meet less than optimal fluid needs through plain water alone, so adding moisture-rich foods is a practical, tasty way to keep filtration running smoothly. Start with foods that are mostly water but also bring nutrients. Watermelon is over 90% of water and supplies lycopene and potassium, making it both refreshing and kidney-friendly. Cucumber runs about 95% of water and adds a crisp source of electrolytes and fiber. Celery is similarly water-rich and offers natural sodium and potassium in small, balanced amounts. Other excellent choices include tomatoes, bell peppers, cantaloupe, strawberries, and iceberg lettuce. Each contributes free water plus vitamins or antioxidants that support blood vessel health and, indirectly, filtration efficiency. Coconut water deserves a special mention. It provides natural electrolytes like potassium and magnesium and can be a good lower sugar option after exercise to help restore fluid balance. Practical integration matters. Blend a simple smoothie of cucumber, a handful of berries, a splash of coconut water, and a few ice cubes for a hydrating snack that replaces sugary drinks. Prepare cold soups, such as gazpacho or a chilled cucumber yogurt soup, to increase fluid intake with meals. Pack sliced melon or orange segments and bell pepper strips for portable hydration during the day. These choices help dilute urine, which can reduce the concentration of stone-forming minerals and reduce strain on filtration without requiring constant sipping of plain water. Mindful caution is important for people with existing kidney disease or a history of certain stones. Some leafy greens like spinach are high in oxalates and could contribute to calcium oxalate stones in susceptible individuals, while potassium-rich foods may need to be limited if a clinician has advised a low-potassium diet. The best approach is to use hydrating foods as part of a balanced plan. Include a hydrating fruit or vegetable with each meal. Choose broth-based or chilled soups. Swap one sugary beverage per day for a water-rich snack. And check with your nephrologist or renal dietitian if you have chronic kidney disease. Try adding one hydrating item today and observe how you feel. And if this helped, share the recipe with a friend and talk to your healthcare provider about tailoring hydration to your kidney's needs. 6. Best herbal infusions for kidney health. Hello, my name is Dr. Greg Smith, and today first I'm going to tell you about herbal infusions that can gently support kidney function and urinary tract health. Kidneys work by filtering waste, balancing fluids and electrolytes, and removing toxins. When they're stressed by dehydration, dietary excesses, or recurring urinary issues, supportive measures can help ease that load. Herbal infusions are not a cure, but several plants contain diuretic, anti-inflammatory, antioxidant, and soothing compounds that make them useful adjuncts for maintaining kidney comfort and flushing the urinary tract. Nettle, Urtica dioica, is a nutrient-dense choice, rich in minerals and traditionally used as a gentle diuretic and anti-inflammatory. A warm nettle infusion can support mild fluid balance and provide B vitamins and iron in small amounts. Dandelion leaf and root are commonly used for their mild diuretic and digestive supporting properties. The leaf is often favored for fluid regulation, while the root is used for liver support, which indirectly reduces burden on the kidneys. Corn silk, the fine threads from corn husks, makes a soothing, mucilaginous infusion that many people find calming for bladder irritation and frequent, irritating urination. Horsetail offers silica and has been used as a diuretic and to support connective tissue. However, it is best used short-term because of potential nutrient interactions and the presence of compounds that can affect vitamin levels. Parsley and cranberry are two commonly discussed plants. Parsley has diuretic properties and culinary familiarity, but high intake may be problematic for people prone to calcium oxalate stones. Cranberry supports urinary tract health by inhibiting bacterial adherence in the bladder, though it is more targeted at infection prevention than kidney function itself. Preparation and practical use matter as much as the herb chosen. Use fresh or properly dried herbs brewed in clean, filtered water. Cover the infusion while steeping to retain volatile oils, and strain before drinking. Combining herbs can be effective. Nettle with dandelion leaf creates a mineral-rich, balanced cup, while corn silk paired with a calming herb like chamomile can ease bladder spasms and reduce burning sensations. Pay attention to how your body responds. A mild increase in urine output is normal when using diuretic herbs, but pain, fever, blood in the urine, or reduced urine should prompt immediate medical consultation. People with diagnosed kidney disease, those on prescription diuretics, blood thinners, ACE inhibitors, or with pregnancy should check with their healthcare provider before adding herbal infusions, because interactions and contraindications are real and important. To integrate these infusions into a kidney-friendly routine, focus on consistency and safety. Maintain good hydration. Use herbs as a complement to dietary measures, like reducing excess salt and processed foods, and start with small amounts to assess tolerance. Keep a simple journal of what you drink and any changes in symptoms. This helps your clinician adjust guidance based on real feedback. If you want to explore a targeted blend, discuss it with a qualified practitioner who can factor in your labs, medications, and stone risk profile. Try one infusion at a time, observe effects, and when in doubt, get a professional opinion. Your kidneys are too important to experiment with blindly. If you found this helpful, consult your healthcare provider to tailor a safe plan and consider subscribing for more practical tips on natural ways to support kidney health. Hello, my name is Dr. Greg Smith, and today first I'm going to tell you about. Did you know your kidneys filter roughly 200 liters of blood every day? That's why small changes in diet can make a big difference. If you're worried about buildup, infections, or kidney stones, the problem is often dehydration and inflammatory foods. The solution is simple, everyday ingredients that support flushing and balance. Quick recap of the top 5 we covered. Stay well hydrated with plain water. Add cranberries to help reduce infection risk. Squeeze lemon for citrate that can discourage stones. Eat parsley for its gentle diuretic and antioxidant support. And enjoy watermelon for hydration and potassium balance. These foods may help dilute urine, reduce crystal formation, and lower inflammation when used regularly. Make it practical. Swap one sugary drink for water. Start your day with lemon water. Snack on watermelon. Mix cranberries into yogurt, and toss parsley into salads or smoothies. Always check with your doctor if you have chronic kidney disease or take medications. If this helped, hit like, subscribe, and leave a comment telling me which food you'll try first. Next time, First will share a 7-day kidney-friendly meal plan and easy recipes to get you started. Stay consistent, listen to your body, and First will see you in the next video.